But the reason why community is important is it goes beyond like healthcare. We do more than just traditional therapy, psychiatry, or helping people with supports.
Yeah, looking at the person as a whole. All right. Hey, welcome back to another episode of Ottawa Out Loud, the official podcast of Ottawa County. I am your host, Scott. Thanks so much for tuning in. We've got a great one for you today, a very informative episode about a lot of important topics regarding our community mental health department. I have the director of community mental health here with us, Dr. Michael Brashears. Doc, Mikey, what do you want me to call you?
Dr. B, Doc's fine.
Okay, perfect.
Yeah.
And hey, while we're at it, we haven't had a doctor on the show before. Can you tell me, does this look infected? No.
Yeah, well, I'm a psychological doctor, so I'd say, I don't know.
Does this look infected?
I would say, are you worried about it?
Not a ton of announcements today. The only thing I have to say is that there are board meetings coming up as always. So check boards.myottawa.org for the upcoming board meetings, because you're going to want to watch those. If you don't have time to watch a board meeting, that's A-okay. The day after every single board meeting, you will see an episode of Meeting Minutes, a 3-minute or less summary of that board meeting, just in case you don't have time. But sometimes the board meetings are kind of fun to watch. You get sort of an inside look, and you get into the details a little bit. But we're going to launch right into our main segment, because I believe we have a lot to talk about, right?
Oh, absolutely. There's a lot going on at community mental health, for sure.
Always is, but especially right now. First, want to allow the people a chance to get to know you a little bit. Tell us a little bit about sort of your background and career path and how you ended up here at the table with me today.
I've had a pretty long career. I've been in kind of behavioral health for 30 years. So, education and training, I hold a bachelor's, master's, and doctorate in clinical psychology and family psychology.
Nice.
But I've spent the majority of my career in administration managing large systems of care, such as inpatient hospitalization programs. I was the clinical director for a long time in a hospital in California. I was raised in Massachusetts. I'm a Boston guy. First city, outside of Boston, city of Newton, which is the first suburb west. My neighbor down the street was Matt LeBlanc from Friends.
Oh, wow.
But I grew up in Massachusetts. I moved to California when I was 18, went to school out there. Not too many people know the school I went to. It's called the Azusa Pacific University. It's like a Hope College, but on the West West Coast. It's much bigger than Hope.
Right.
And the good thing about Azusa Pacific is no matter what you study, business, film, psychology, you also have to understand theology, philosophy, and logic. So you get a well-rounded education from kind of like a traditional classical education. Moved to Michigan in 2001. Right at the end of right at 2001, I worked at the community mental health in Lansing there for 3 counties, Clinton, Eaton, Ingham. I was the director of adult mental health. Worked there for 7 years. Loved it. Loved Michigan. Moving from California after school to Michigan. And then, believe it or not, in 2008, I was actually hired as the executive director for community mental health in Ottawa County.
Whoa.
So I did
There's a story here.
Yeah, I did that until 2013.
Okay. 5 years.
And, one of the reasons why I left the county as executive director is my wife had passed away in 2009. And suddenly I have 4 children, a son who's older, but at the time I had 3 very young girls, 10, 7, and 18 months. And you can't actually do the executive director job of CMH as a single parent.
I can't imagine. Yeah.
So I left Ottawa County, and that was a hard decision, but I owed it to the citizens to be able to say you need somebody else in there. And I actually had hired Lynn Doyle to be my deputy, and she took over as CMH director. So you fast forward, like in between 2013 and now, I was the executive vice president at Hope Network, which is the largest behavioral health provider in the state. So I did the provider side. Private practice, I did that.
Okay.
And then I was involved with kind of like the mental health millage in Ottawa County. And at the time, executive director Doyle asked if I would be on that committee. And then she had some health issues and retired. And I was asked to be the interim and then back as executive director at CMH now since July, of 23, that would be.
Okay.
So almost a year and several months.
Yeah.
And we changed the title to Chief Executive Officer, CEO, because that's the title that every other CMH director has in the state.
Gotcha. Okay.
So-
I was going to ask about that.
Yeah,
'cause
so that's why-
I just assumed director for most departments, but chief executive officer.
Yeah. Well, technically, I'm not an employee of the county. I'm actually an employee of the CMH board, hired by the Community Mental Health Board.
Okay.
I get county benefits. I have a dotted line to the county administrator, not a straight line.
Yeah.
So I have kind of like a different relationship than some of the other department heads.
Yeah.
I'm not an elected official, so I'm not like the sheriff, but I'm hired by the CMH board. I guess the best thing to know about me is the thing I'm most proud of is my children.
Yeah.
And doing this job and other jobs and watching, now they're older now. Now instead of being 10, 7, and 18 months, now they're 26, 23, and about to be 18.
Wow.
And when I was thinking about applying for this job, to be honest with you, I asked them, and they said, "Dad, you've always liked that job." And I did, and I felt like I did well at it, and I really enjoyed being part of the public mental health system as a director. And I basically wasn't asking permission, but I felt like they were saying to me, "We're good. You can spend the time you need to do this job now."
Now's the time. Yeah.
Because the job is easily between 50 to 80 hours a week job.
Wow.
It's not a punch in the clock, 9 to 5. It's nonstop. And
Yeah.
that's one of the things I like about it.
Right.
And really, it's an honor to be part of community mental health, especially in Ottawa County, but to be part of the system, because we are the essential safety net for all of behavioral health.
Yeah.
For folks with mental illness, kids with mental health issues or emotional disturbance, autism, adults with intellectual and developmental disabilities, and substance use disorder folks, people that are
we had a whole
struggling with-
episode about that. That was
Right.
awesome.
And we are not only the safety net for the community, but I would argue we're a center of excellence for the delivery of care for those groups. With county, we directly operate a lot of our services through county employees. We have over 220 employees.
Wow.
Not all filled right now, but we have about 170 positions. We have some that are floating out there.
Sure. Got to be one of the biggest departments.
Yeah, I think we're the second largest.
Yeah.
I wish we had more space. I'll put in a plug for that.
Yeah, right.
But
get there someday.
we directly operate a lot of the services that we do. And we definitely have an array of contract providers too. We have over 190 contracts we manage for the delivery of services, a full array in Ottawa County.
Right. So a ton of different options, really.
So my personal story and who I am are intertwined with public mental health because since 2001, I've been in part of the mental health system publicly in Michigan in one way or another, either as a CMH director or an executive vice president in a large provider, or as an independent clinician working with the system.
Yeah, it's nice.
So
You've worked with a lot of the organizations that we're now partnered with, so you kind of understand things from their perspective a little bit when you're working with them, right? That's got to be a benefit.
Yeah, and it doesn't hurt, put it that way.
Yeah,
Definitely helps to understand the unique challenges. But,
Yeah.
The advocacy that we do for the people that we serve is one of the most aspects of community mental health.
Yeah, very important.
And, keeping the community in community mental health. And I thought I'd talk about that for a moment, if you're okay. What does that really mean?
Absolutely. I mean, it's not just the mental health department. It's the community mental health, and there's a reason for that, right?
Right. There's been an interesting phenomenon that's happened in the community mental health system in Michigan. A lot of CMHs have changed their name from community mental health of, say, Allegan County or community mental health of Kent County to things like On Point or Network 180 or CMH of, Ionia County is now called Right Door. Right.
Interesting.
And so some of the reasons why that happened in the system was to decrease stigma. So that people that were receiving community mental health services could say, well, I'm going to On Point for services, and they may be doing a whole bunch of different services besides, I have a mental illness and I'm going to CMH.
Right.
And I have a different philosophy with that.
Yeah.
I think it's vitally important that we identify it as community mental health.
Yeah.
We're responsible for the mental wellness of our citizens, educating our citizens, and providing it. And I think other organizations can have a different view. It's fine.
Yeah.
But the reason why community is important is it goes beyond like healthcare, what we do. And so we offer education. We offer services that help people get to places. We do more than just traditional therapy, psychiatry, or helping people with supports.
Yeah, looking at the person as a whole, right? And that's something that I look at. I know this is a technically a public health thing, but like the Pathways to Better Health program, where you're not just building a wall around community mental health and saying whatever you're going to do is within here. There are so many different partners, and it's not just because what's going on up here is affected by what's going on out here and everything.
Yeah, and as you know,
a system.
As you know, community mental health both helps fund and participates in partners in health with the health department and other folks because of what you're saying, right? Yeah. Community mental health. When you view yourself as part of the community, you're working with your sheriff, you're working with your jails, and we have programs to do that.
Yeah.
And
talked about that with Daniel and Max when they were on a few months ago, and that was really, really cool to hear about some of those programs. And it's so cool.
So community to me in mental health means doing things beyond, say, our Medicaid services, which is a lot of what we do, traditional behavioral health or supports for people with Medicaid.
Got to have that.
It transcends Medicaid.
Yeah.
And so my philosophy and our philosophy at Community Mental Health is keeping the community in the name and in the mission is absolutely job one.
Yeah.
Or you don't. And it's, to get in the weeds a tiny bit,
sure.
It's linked to the community mental health movement that started with JFK in the late 60s.
Wow.
And when we took people out of institutions, big facilities, and moved them into community and give them support, started community mental health.
Treating people like people.
Yeah, and it started what I call a distinct tradition of care called community mental health.
Yeah.
And so if we don't keep those roots, then we'll follow the trend in a lot of other areas where you're more like traditional medical model healthcare.
Right.
And we don't want to ever be that.
Yeah.
There are tons of people that do that. We need to help people where they're at, when they need us, how they want help, and can't be so prescriptive of, well, you have 5 sessions and we're a health plan and we're monitoring them and you got authorizations for 10 more. We do utilization management, but in a non-medical model way to meet their needs.
Because that can be such a burden if it's handled in such a robotic sort of way, I feel like, and people have enough to worry about.
Sterile. People can contact CMH, and if we can't help you, we'll find who can.
Right.
We have navigators.
Yeah.
So somebody contacts CMH.
Yeah,
and we have a navigator program that, hey, you might not meet our eligibility requirements. Right. But you know what? We have individuals that are going to figure out what you need, and we're going to find where we can get that in the community. And we're not just going to send you there like good luck. We're going to make sure you're connected, and we're going to make sure that they can see you, and we're going to keep holding on to you.
Yeah.
Until then. And we're one of the only CMHs in the state that does that.
Yeah, the warm handoff.
Community navigation that way. It's not even, it's more of like a relationship building.
Right. You're not even handing them off. Yeah, absolutely.
And community to us transcends traditional, what people would think traditional behavioral health services. Yeah. It transcends that. It means you're there. We're like the fire department in the level of importance, or the police.
Right.
We're not a medical program that you can just say, well, all right, just go over there. We're an integral part of the safety net.
Yeah.
A lot of people don't know this, that community mental health, if you don't have insurance, or if you don't have, or if you're on Medicaid and you need to go in a psychiatric hospital, we have to approve that.
Yeah.
We have to interact with you. We have to manage that. We're the safety net.
Right.
So all these people that don't have insurance, in and out of jails, homeless, in and out of shelters. When they need to go into the hospital because they're having a psychiatric crisis, we get involved, we assess, we admit, and we pay for it.
Yeah.
We manage the budget to do that.
Yeah.
And that's a core function of community mental health that's outlined in the mental health code in Michigan. CMH has to exist.
Yeah.
It cannot be eliminated.
Right. So that's not even close to being in the books. Yeah.
There is no scenario where CMH isn't here.
Yeah.
What we deliver, how we manage things is the question.
Right.
But there's that community part of community mental health. And a lot of that's funded, believe it or not, by the millage program.
Yeah, I want to talk about that a little bit for sure. I know that Medicaid, you're reimbursed essentially for some costs, a huge amount of costs with Medicaid. But where does the millage fit into all that?
Yeah, so Medicaid, our total budget is around $73 million. Medicaid pays for 90% of that.
Okay.
And so what the millage does is it fills in the gaps where the Medicaid program doesn't fund. We're not adequately funded, even with Medicaid, to do everything that we're asked to do.
Yeah, and I know that there's so much in limbo with just Medicaid itself right now, too.
And I'll tell you, we don't have the ability at CMH to limit services based on the amount of money we have. So I could never say no.
Yeah.
So millage, it's about $4 million a year. It helps us have programs that focus on that are community-based in the community for anybody to participate in, and it helps fill in the gaps where the Medicaid program is not. Without millage, we'd be in deep trouble in keeping the community and community mental health. There would be hundreds of people that wouldn't have access to mental health care because they're not on Medicaid, right? And so in the old days, to get in the weeds a little bit, the state would give us state general fund mental health dollars to cover that gap. Those have shrunk significantly over the years.
Yeah.
So Ottawa County was the first county in the entire state of Michigan where the voters said, we are going to invest in our CMH department. We are going to pass a millage. And, you'll be seeing all kinds of information over the next several months, like how we've done the last 10 years, what is funded, what would happen if it's not there.
Right. And it is worth noting for anyone who doesn't know at this point, the vote to renew this millage is coming up. That's going to be
in August.
Perfect. Thank you. Alongside the Parks millage. And we'll have the opportunity as a county to decide if we want to renew it. And we're not here to tell you how to vote, of course. I will never do that, nor will Dr. Brashears.
No. I'll just tell you, I'll be able to provide information of what it's done and what it would mean to lose it. I actually, by law, can't say go out and campaign for it.
Right.
What I can tell you is the impact of it. But the reason why I bring it up in the context of this discussion is because millage is an essential part of keeping community mental health in the name, community.
Right. Community.
Without millage, we would just primarily be a Medicaid healthcare provider, like Hope Network, which is a great organization, or other providers. We wouldn't be managing anything. If you don't have these other programs in support of traditional kind of services, then our folks don't show up.
Right.
So it's like, great, you have a Medicaid program, they don't come. Why? Because they can't get there.
Right.
And by the way, they have complex needs and they need someone to wrap around them.
Right. I mean, everyone has complex needs. It's not at reach to say,
So community mental health, the community part of that, it's always been a part of our history.
So important.
But through the years, we've become more and more reliant on Medicaid. Right. And Medicaid has very specific rules of what we can pay for and what we can't. And we don't have a lot of flexibility to go beyond what you were saying, to meet. We have more flexibility because of millage to do that, because Medicaid doesn't allow us to stray from, you're only paying for this service, this amount of it, you got to write a note, And the way we're funded, just a quick little refresher. So you would think that, okay, we do a Medicaid service, right? And we send a bill to our region, the state, and they go, oh, you did a service, here's the money back. That's called fee for service. We don't have that. What we have is CMH is given the same amount of money based on the number of people on Medicaid in our county, and we get 12 equal installments, and we have to meet everybody's needs based on that. So there's no financial gain for us if more people show up. In fact, it's not, from a financial perspective, advantageous for people to show up. Because we get the same amount of money if 10 people show up versus 100. Now, there's some nuances where that's not exactly true, but
Right.
by and large it is.
But that seems really antithetical to the point of
Yes.
CMH.
That's right.
The way the system
And so
is set
if we
up,
didn't have millage or other funding sources, and we're only getting this much this much Medicaid to serve this many people,
Right.
you could see that we have the inability to meet our mission.
you'd be almost encouraged to offer less. Which is really not a position that you want to be in. You want to be encouraged
and
to
not
more.
only can we not encourage it, it's illegal for us to deny service or reduce service based on your budget. So
Catch-22.
You wouldn't manage your house this way, right? Like, okay, I'm going to keep spending and spending and spending.
Well, I like doing that personally.
If the revenue's not there.
Right.
So I have board members and county commissioners that will look at me and they'll say, when we're educating them, they'll say, so let me get this straight. You can't shut the front door, correct? If somebody needs an increase in service based on what their needs are, you have to do it, correct? And your revenue doesn't increase when any of those scenarios happen. Correct. So Dr. Brashears, how do you manage the budget? The best you can. It's a balancing act of getting more revenue, managing the best we can, and then advocating for what we need to do. And so that's the situation that people have to understand. It's not like we could do traditional budget adjustments like we just won't pay people or we'll just cut staff because the demand doesn't end. It only increases.
Yeah, but that has such a ripple effect, reducing staff and reducing benefits. I mean, it's hard enough out there.
Right. So millage, the other funding sources helps us deal with that reality on the Medicaid side. Yeah. The other thing I'm so proud about with our staff is that we deliver high quality evidence-based services. Better, I'm going to say it.
Say it.
Better than the private sector.
Loud and proud.
Better than the private sector. That's why I got back into it.
Boom.
I got folks in family services working with families that have high degrees of conflict and people with emotional disturbance that are using home-based models, doing the services in their homes, using other evidence-based practices that you can't get outside the public system. We got adults with mental illness getting DBT, which is an evidence-based practice, in a very unique way for folks with complex mental illness. You might be able to get a little bit in the private sector, but we do it as a general rule. We have over 5 distinct evidence-based practices that we use that are required for us to use. So we have some of the highest trained, most competent staff that you can find in an organization. And we are darn lucky to have them. So when people think of CMH, they might think of, oh, it's a county bureaucratic department and they're just collecting a paycheck. No, this is the SWAT team. I mean, of mental health, working folks with developmental disabilities that you have. Our public system is far superior, and I'll show you the outcome someday if people don't believe me, to outcomes than the private sector.
Okay.
And it costs money, and it costs. We have staff that are dealing with people with the most severe forms of mental illness, family issues, developmental disability, substance use. We don't serve the people in the mild to moderate primarily. It's all serious. So to the 170 CMH employees that might watch this cast, all I can tell you, it's an honor to be part of an organization that's a center of excellence, and we can only get better. And that's one of our strategic plans.
Absolutely.
How to keep community and community mental health, and how to keep moving forward with center of excellence. We're doing it in an environment that doesn't pay for any of it.
What a challenge.
And I'll tell you, and so the staff were like, okay, how are we going to pull this one off? And they do, and they really do. And so center of excellence means that we're committed in developing the types of service in the way that the evidence suggests is the best way to do that. And it's also simultaneously person-centered. Meeting that individual's needs.
Like we talked about,
So you got both of them, community mental health, C for community, what we're doing with millage and all kinds of programs, and then center of excellence. And we're doing that in an environment that doesn't pay us enough, that adds The state gives us all kinds of bureaucracies and new tools to use and new things, and they're still having great outcomes with people.
Yeah.
And so as a safety net, it's important to know all this, that what we do for the community, but we have a high quality behavioral health organization trying to do things in an environment with changing Medicaid.
Yeah.
And I can kind of talk a little bit about that if you want.
Yes. I would love to talk about two elephants in the room we wanted to talk about.
That's right.
At least address here, and one of them is the changes being made to sort of the state system and how Medicaid is interacting with that. It is a complicated system, so whatever.
So there are two things that are going on right now that impacts our ability to be a community partner and a center of excellence. Impact meaning good or bad, just depending on the outcome.
Right. Change.
The first thing, at the higher level, at the state level, right now, the Michigan Department of Health and Human Services has a proposal and have already started to initiate a proposal to change how the Medicaid benefit that we manage, who manages it. And it's a quasi-privatization plan where CMHs, if the state gets what it would want, the state being the Michigan Department of Health and Human Services, because there are other things in the state that are not doing this, and legislators are definitely not the ones writing this up right now. So shout out to them saying this is not their plan. This is the actual department.
Okay. That's good to know.
Right.
Yeah.
It's not our legislators saying we must do this. Okay.
Right.
In that plan, the ability for community mental health to kind of manage with the contracts we have, like residential services or home-based services, would be moved from us to this greater entity above us in a way where we're not able to coordinate all of the services on the Medicaid side in the way that we would need to ensure people get that benefit.
Because you still have that legal requirement.
Still got to be here. Still got to do it.
Ugh.
But us being able, remember I talked about those like 12, those payments we get all at once?
Right.
They would move us to just becoming a provider only for the services that they want us to provide instead of us managing the Medicaid services for the whole county. It gets a little complicated. That has a dramatic impact on who we are.
Gotcha.
And what our role is as a community mental health. And we're supposed to hear something on that from a judge coming up. It's supposed to be Monday.
Hoping to have something.
Because CMA system, we all sued. Like, no, how are we supposed to do what we're supposed to do if we're not part of managing the Medicaid system, holding the contracts, managing the benefit?
Right.
And so we're waiting to see what happens. And once we know, I'll definitely be doing all kinds of meetings and here's the impact and all of those things.
Yeah, maybe one of your Did You Know?
Yeah, we'll probably have a week long. We'll have one every day, forever, till we know it.
So yeah, if you are interested in getting into some of these topics in a longer format, a little bit more in depth, the doc here does do. They're live streamed on YouTube. A series called Did You Know? There's been a lot of them already, but changes will be addressed in that.
And I got 2 episodes already there on this issue that you can watch, and I actually show you what the state's plan is.
I'll link those in the description.
So the other elephant in the room,
if
you've been paying
2
attention,
whole elephants.
Right. Yeah, it feels like a circus sometimes, right? All the elephants. I'll start with some background. There are 46 CMHs in the state of Michigan. 41 of them are called CMH authorities.
Gotcha.
Only 5 of us are county departments. Okay, so right now, Community Mental Health of Ottawa County is a department of the county of Ottawa.
Yep.
And 91% of all of the other counties, that's not the case.
Yeah.
The community mental health is kind of separate from the county in terms of a department in its own authority, quasi-governmental authority.
Right.
This has happened since 1996, and it's a long story, but all CMHs were county departments before 96.
Right.
After 96, there's ability for counties to decide if they want the CMH department to separate out and be an authority.
Sure.
We'll be having information of what the differences are between a department and an authority.
Right.
So for CMH staff and people and the citizens, it's like, well, what does this mean? Yeah. If I'm a staff member, it's like, would I be a county employee if you're an authority? The answer is no, you would not. You'd be an employee of the authority. Well, of course, there's all kinds of ramifications for all of these things.
Yeah.
We're in a dialogue at the county level of how, if we were to become an authority, what would be the impact and how we would do it. And we're having those discussions. We're planning. one of the requirements is once you say to the world, I'm interested in looking into being an authority, you have to have public hearings.
Yep.
And so if you were watching kind of like the board organizational meeting yesterday, they debated for 2 hours.
We're recording this on December 19th, by the way, in case anybody
Right.
is wondering on that. So we had a
Yesterday.
board meeting yesterday that talked about this
Right.
quite a bit. Yeah.
So there'll be more to come on this, but you pair that of what's happening at the state level, which is really what's the role and function of CMH,
Right.
right? That's that decision, with the county authority, and then what type of organization will be you will be to carry out that role and function is really the two distinctive parts. One is global. Here's your role. The other is how you would organizationally carry
Right.
it out as a department or an authority.
And that's the
pros
hard
and cons.
part for a lot of folks, myself included, for
Yeah.
sure, to grasp. And you got to really know a ton of the background and the structure of it, and it's so complicated. And it's honestly, I find it hard to expect anyone to be able to wrap their head around it.
tough.
It's amazing that that work is being done, and I can tell there's a lot of work being put into understanding any benefits, ramifications, otherwise of this.
Sure.
Before we even go ask
Proceed.
the question. We're talking about asking
and even
the
if the
question.
county said yes, because only the county commissioners can make this choice.
Yeah.
Believe it or not, the CMH board doesn't get a vote. I don't get a vote.
gotcha.
In fact, the CMH board could say, yes, do it. And the county could say, no, we're not doing it. It doesn't get happen.
Right.
And when you become an authority, believe it or not, if at any time the county said, we want you back, they can do it. So county commissioners are in complete control about how a CMH organization is structured. You can either be a department,
Yeah.
or you can be an authority, or you could be a department in combination with other county departments called an organization. And there's only one of those in the state.
Gotcha.
So the county always, 100%, gets to decide how the CMH department is organized,
Yeah.
either as an independent authority, like the road commission
Yeah.
or central dispatch, those
Yep.
are exampers,
Yep.
or as a department.
Right.
Right.
So there's a link there still. You're not being
Forever.
spun off as some independent organization, and we never talk ever again.
No, right. There's still and by the way, county commissioners would still appoint all members to the CMH board,
Right.
no matter how you're structured.
Right.
So I talked a little bit more about that elephant in the room because that one has actually kind of picked up steam in the last week or two.
Right. Yeah.
And, I think it's a good opportunity for people to understand more information is coming out on that.
Yeah.
But when I talk to my CMH colleagues around the state that have the same position, they're like, we've been doing this since 1996. You guys haven't done it yet.
Yeah. Right.
The impact to services has to be looked at, the impact to our clients we serve. And traditionally, there's no impact, but you still have to do due diligence to make sure,
Yeah.
because there really would not be an expected change on what the community would receive, but how we would manage it.
That's important because that ultimately does affect how things are actually administered.
Yeah.
For sure.
And if you become an authority, it doesn't impact the millage at all. Same thing.
Right.
Same process, same thing we use, same oversight, same all that with the county.
Yeah. So
doesn't change
you're
it.
saying people shouldn't really factor the authority conversation in with their millage
That's
vote.
correct.
Okay.
There's no relationship to them unless one creates one out of thin air.
Right, because I mean, the road commission has a millage, 911 services has a millage, and everything.
That's right.
So
And because we are the pioneers in Ottawa County on the mental health millage, the state will be watching on how this handles because we've actually, as a county, figured out, because we've had a decade of doing it, the utilization of the millage, improvements we would make, and we'll be letting the community know that over the next several months and how we're handling it. But we have a lot of programs that are very dependent on the millage, that if the millage wasn't renewed, the community and community mental health would disintegrate.
yeah,
And you might as well call us, make up a name like Behavioral Health of Ottawa County Medicaid.
right. I think the ripple
Cough
effect
syrup
would be exponential. Yeah,
Ottawa County has a long history of supporting its mental health department.
right.
And that shouldn't change.
Yeah.
I mean, why would we do it? It's not an abandonment of the department.
Right.
It's how to strengthen in these changing times, because if the state makes massive changes, then how do we respond to it? And I need to be as nimble as we can.
Exactly.
So other questions you might have for us?
Yeah, well, I only had one more, and it's a wrap-up question. First of all, thank you so much for giving that explanation. That's a lot of information that I did not previously have, and I would assume that is the same for a lot of our viewers. I have one simple question for you, and there's a lot of complicated stuff going on. There's a lot of crazy stuff going on in the world right now. What's bringing you joy and peace right now?
Witnessing everyday examples of people being kind and supporting each other and being aware of it. Acts of kindness, grace that I'm seeing that I don't even have to be involved in.
Yeah.
And it's making me feel like, okay, we're focusing on the right things. And, you know, there are always challenges. There are always major issues. There are always scary things going on in the world. There always have been.
Right.
And so for me, what's bringing me joy is just allowing myself to take in what I'm observing, and it doesn't have to be me generating it.
Yeah.
And it's kind of giving me a nice...
Seeking out the positives.
Yeah, little things like my kids being nice to each other. It's nice, right? You know,
Yeah, right.
Or, you know, and I see it all the time, you know, at CMH. People trying to solve complicated problems, but still doing it in a nice way.
Yeah.
A respectful way.
Amazing. Yeah, and I do, every interaction I've ever had with a CMH staff member has been overwhelmingly positive, and I do see a lot of joy and hope whenever I have the pleasure of working with the CMH staff. So well done for maintaining that throughout all this. So that's all the time we have for today. Again, thank you so much for coming on and imbuing us with that information.
My pleasure, anytime.
Well, folks, that is all the time we have for you today. I hope you enjoyed that conversation as much as I did. We will be back in just a few weeks with another episode, so make sure you're subscribed. Make sure if you're on YouTube, there's that little notification bell. You ding that, and that'll send you all of your videos directly to your notifications section on YouTube. If you're on Apple Music, Apple Podcasts, or Spotify, follow. I don't know what buttons there are for that. But
I love Spotify, so there's a way to do it.
Hey, there's a way. Thanks so much for watching. And remember, knowledge is power, and local government works best when you're a part of it. We'll see you next time.